848, a 55 KRCD talk station. I love talking to the doctors from OHC. They're my cancer doctors. You're going to be in the best possible hands. If you get a cancer diagnosis, you want to talk to the folks at OHC or get a second opinion from OHC. 888-649-4800, online, ohcare.com. They've served me well, and I know they'll serve you well, and especially if you've got lung cancer, Dr. Anupal, who's a medical oncologist, hematologist with OHC, going to be here to be talking about the newest treatments and latest success. We always talk about success when OHC is on the air with lung cancer treatments. So welcome, Dr. Paul. It's a real pleasure having you in, and congratulations on the new position. You've been there 3 months, so you're not exactly new.
Thank you, Brian. So I've been here for like 3 months, and I've enjoyed time working at OHC. This is Lung Cancer Awareness Month, so I'm glad to be here to talking about lung cancer, the newer treatment options, and early detection.
All right. Well, I have notes. Clearly, I'm not a doctor, nor am I a lung cancer specialist, nor do I play one on radio, but lung cancer is the second most common cancer in men and women, you say, behind prostate and breast cancer, respectively. I kind of expected that figure to have dropped some. I mean, we all got the memo, quit smoking, because that's the leading cause of lung cancer. Is this still smoking related primarily, or is there environmental relations with why we continue to have such a high incidence of lung cancer?
Very good question. So it's still primarily smoking related, although the smoking related lung cancer is slowly declining. But unfortunately, in certain groups and certain ethnicities, especially young women, Asian descent, the lung cancer rates are unfortunately increasing. There's also like environmental exposure, air pollution, radon exposure, which is unfortunately common in Ohio too.
Yeah, radon. Yeah, I think I have my head in the sand on doing the radon check. I've been in my home for 30 years, and I'd just rather not know. Don't quote me on that, doctor. Anyway, I understand there are two types of lung cancer. Can you break that down for my listeners, what the two types are and how they differ?
Yes. So there are two types. One is small cell lung cancer, and the other one is called non-small cell lung cancer. The lung cancer, it's called small cell based on how it appears under the microscope. Small cell lung cancer, unfortunately, tends to progress rapidly, and fortunately, it's less common. Only 10 to 15% of lung cancer is small cell lung cancer. It definitely has a high risk of association with smoking. Almost 95% of patients with small cell lung cancer have some smoking history. And the 5-year survival rate for extensive stage, also known as stage 4 small cell lung cancer, is still very poor, only 7%. And non-small cell lung cancer is more common, and it's again divided to several subtypes. It is still tied to smoking, but in general, non-small cell lung cancer has better survival rate, and especially, when it's diagnosed in lower stages.
All right. We did talk about the risk factors. 85% of all lung cancer is caused by smoking. Secondhand smoke can be an issue. That's like an environmental reality that we're all facing. You mentioned the radon. Before we get to treatment options, what are some of the early indicators that you may have a problem? You may be having lung cancer. What should I be looking for example, in my world?
Sure. So if you have a cough that's not going away after, let's say 4 to 6 weeks or so, then I think definitely it should get evaluated, especially if it's somebody with smoking history.
Right.
You need to see your primary care rather quickly.
Yeah, don't chalk it off as just smoker's cough.
That's right.
You may have a bigger problem going on.
Exactly. Also, like new onset shortness of breath or worsening shortness of breath. And if you have like bloody sputum, then definitely losing weight without trying, that's another reason, you need to see your primary care and get further evaluation.
All right. Turning to treatment options, we need to get that low survival rate figure up. So what are the treatment options we're talking about now, doctor?
Sure. Before we go to treatment option, I do want to say in patients with a smoking history, we usually say 20-pack year smoking history, or those who quit within the last 15 years or so, we recommend getting an annual low-dose CT scan for lung cancer screening, because the goal is to catch it early. So
Right.
in anybody who is between the ages of 50 to 80 years of age and has a significant smoking history, definitely follow with primary care and get CT scan scheduled, just like how we recommend mammogram for women.
Okay. So since I'm getting a general body CT scan from neck to waist for my lymphoma, then if I have any issues with my lungs, they're going to red flag that for me during that process.
That's
Good.
right.
All right. Don't have that to worry about then. All right. So the treatment options. So obviously, this has something to do with what stage you catch the cancer at.
That's right. So the treatment options depends on what kind of lung cancer it is. It can change between small cell and non-small cell lung cancer, and also, what stage it is. So stage 1 is the earliest stage. Usually those lung cancer, we are talking about non-small cell. Generally, we do like surgery, some cases radiation therapy, which is directly targeted towards that lung nodule. So in that way, the toxicity is less. When it comes to stage 2, we still opt for surgery, but some patients may need some upfront chemo immunotherapy to shrink the tumor. And then stage 3 and beyond, generally it's chemo radiation. When it comes to stage 4, that's when the molecular testing makes a huge role, because I would say, 10 years ago or 15 years ago, we used to give chemotherapy. There were no role for like immunotherapy or targeted therapy. But now we have those new treatment options. Historically, non-small cell lung cancer, like roughly 10 years ago, the survival rate for stage 4 non-small cell was around 4%. But now it has changed, and especially with targeted therapy and immunotherapy, certain subtypes of non-small cell lung cancer are, like 20 to 40% 5-year survival rate, which is
Oh,
very
wow.
impressive.
That is amazing progress. And I know you at OHC were involved with these new treatments. So you're always doing that. And which leads me to what I always end with, clinical trials, which OHC is always doing. It's the place to be. Clinical trials. You have clinical trials related to lung cancer going on?
Yes, we have over 10 different trials for lung cancer, both non-small cell and small cell lung cancer, focused on improving quality of life and better outcomes. These trials help us to truly individualize the care plans that will lead us to treating cancer more effectively and eventually curing lung cancer. One other thing I do want to bring your attention to is a newer treatment called BITE therapy.
Oh, yeah.
Yeah. So BITE therapy, it stands for bispecific T cell engager therapy, or in other words, it's kind of like a drug that acts like a matchmaker or a bridge that brings your body's immune cells directly to the cancer cells to kill them. And the BITE therapy has been used in small cell lung cancer. It just got recently FDA approved like a couple of weeks ago, and this treatment has reduced small cell lung cancer extensive stage or stage 4 mortality by 40%, which is quite impressive. But OHC has this clinical trial with BITE therapy going on even like several months prior to the FDA approval through our clinical trials. So our patients had access to this BITE therapy.
And now it's approved. So I
Yes.
mean, at some point off the shelf, everybody's going to be able to get it. Some of these are bespoke treatments that you create specific to the person, I've learned. Like I said, my dream someday is pull it off the shelf and get your lung cancer or whatever other cancer cured. Dr. Paul, a real pleasure passing along this wonderful information. In spite of the death that typically associated with lung cancer, clearly some massive improvements in life expectancy brought to you by my friends at OHC.